Okay, so the first question Alice asks, what is wrong? What do I need? Is everything okay right now? So, hi Alice, at the moment we did a BPV test. Everything looked normal. It's just an ultrasound test where we look for the fetal movement in your baby, the fetal tone. We're checking for the amniotic fluid. So that came back normal. The next concern that we have is that your blood pressure did go up. So we want to closely monitor that and send you to the labor and delivery room. And we're just going to keep an eye on your blood pressure because with gestational diabetes, we are concerned because preeclampsia could be a risk, which is just an elevation of your blood pressure if it goes any higher than 140 over 90. So we're just going to take a look at that and make sure that you're doing okay. And so, state two prior diagnosis. The first one is risk for preeclampsia due to gestational diabetes, as evidenced by a rapid increase in her blood pressure, as we've seen with preeclampsia. What we're going to do is we're checking her blood pressure twice within 4 to 6 hours apart, and with her, since she's close to the 140 over 90, we're checking her for the without severe features. And so we're going to keep monitoring her blood pressure. If she gets two blood pressures where either the systolic or diastolic is above 140 or above 190, then we can diagnose her with, or the doctor can diagnose her with preeclampsia. I'm going to be checking for edema. I'm going to be listening to her lungs, make sure that there's no accumulation in the peritoneal cavity. The second one is at risk for fetal injury due to gestational diabetes, as evidenced by her high A1C. So for this, even though her blood glucose is stable now, it means that she has been taking insulin, but it was high within the last 3 months. So for this, we are concerned about the LGA baby. So with that, she might have shoulder dystocia. So when the baby's born, we just want to make sure we do the suprapubic pressure, Robert's maneuver. The second one is hypoglycemia. This we would pretty much do a heel stick on the lateral side. For hyperinsulinemia, it impairs the surfactant, which causes RDS. And so this is what's happening, is that there's decreased cortisol production, which makes it difficult for the lungs to mature. So that's an issue going on. And with the gestational diabetes, the increased insulin, so this sugar that's around the baby acts as a growth hormone, and the baby becomes LGA, which keeps the lungs from maturing.